State Representative Bridget Malloy Kosierowski has served the 114th District, which covers part of Lackawanna County, for the past 6 years. Before becoming a politician, she worked as a registered nurse and is currently the only RN in the State House of Representatives. She's leaned on that medical background as she's represented northeastern Pennsylvania, but now it's personal. Kosierowski announced this summer that she's battling breast cancer. She sees that battle as an opportunity to advocate for the health of women in the 114th District and beyond. We recently sat down with Representative Kosierowski and Lackawanna County oncologist Dr. Kristin Liptock to help share the state rep's message. I'm joined by State Representative Bridget Kosierowski and Dr. Kristin Liptock with Hematology and Oncology Associates of Northeastern Pennsylvania. Thanks for joining us for this really important conversation. That all started several weeks ago. Representative Kosierowski posted a video to social media explaining to your constituents what you're dealing with. Wondering if you could tell me a little bit about what that video contained and why you wanted to share that message.
So thanks for having us today. Thrilled to be here. Yes, so we did a video. I felt it was important to two things. One, kind of explain to my constituents where I'm going to be for a little bit off the radar, but more importantly, the message of detection. I was diagnosed with breast cancer, and my prognosis is positive because of the early detection and screening. So I wanted to share that message with my constituents and people, whoever listened, because I think it's important. It's important to make sure to remind people how important early detection is, the screening, the cancers that we can screen for, and the outcomes sometimes are better in those kind of cases.
And they listened. Yeah. What was the reaction to the video?
I was really surprised, pleasantly surprised. The video was shared and viewed by many, but also the messages that I got personally from people that said, hey, listen, I saw your video and I'm actually gonna go get a mammogram. Never had one done, put it off for 3 years. And it was not just about the mammograms. When I say screening, I meant, colonoscopy, pap smear, mammogram, blood test for your PSA for men with prostate. There's a couple we can screen for, a couple cancers we can screen for. And with that knowledge, a lot of times people like Dr. Liptock get patients to her practice that they actually have a good outcome because they were screened early. We have treatment plans from clinical trials and research, and that was the message really. But the outpouring of support. People are kind here. We live in a wonderful valley here in Lackawanna County, and but the people that actually said, I never knew, I never got it done, and I'm gonna go get it because of your story and because you reminded me how important the screening is and your outcome is better, hopefully, because they detected it early. So that was very encouraging, and I'm really happy that I was able to do that video and use my platform and share that message.
We are just getting started on this incredible story. Our conversation with Representative Kosierowski continues after this. Welcome back to Representative Kosierowski's story, The Power of Early Detection. What are some of the barriers, Dr. Liptock, if you could chime in on this, to getting people just to show up to the mammogram in the first place?
So there's lots of barriers, I think, out there, and some of it is not being educated about the services and about their risk of certain types of cancers, not knowing their family history, not knowing when screening is appropriate. And one of the biggest factors is fear. Yeah. So Bridget coming forward and telling her story, I think really can help with some of those fears and have people more comfortable and at ease with getting access to care that they need.
And we're encouraging people to go get a test to tell you whether or not you have cancer. Right. So clearly, I've done it myself. I'm not going to go. Let me get my kids back to school. Let me wait till the holidays are over. I don't have time. I can't get that day off. And it just bombards that kind of snowballing effect. And what we're asking people to go do is, hey, go get your screening, and then let us know what the test said. And sometimes the test, like my test, said we have a problem. It's abnormal. We have a problem, and the diagnosis was carcinoma. So yes, we're asking people to do that, but the good thing is, in many of the cases, that early diagnosis and that screening can let doctors like Dr. Liptock here, treat them.
No family history.
No, and that's what Dr. Liptock said. You have to be aware of your family history. A lot of people, aren't comfortable talking about their medical history, what they're going through. I'm a nurse, so it's very comfortable for me to talk about health issues. But yeah, a lot of times people don't share that knowledge, and I did not necessarily have that in my family history. I have 5 sisters, and my mom. There was no breast cancer, other kinds of cancers, but no breast cancer. So this was a little alarming that I was diagnosed.
I think that's very unique to the people of northeastern Pennsylvania. I know in my family and families of my friends, that even really just like 2 generations removed, breast cancer, ovarian cancer, cancers that affect women, you just didn't talk about it.
Nope.
Yeah. So does that make your job a little bit more challenging when you?
It does.
Yeah.
It definitely does.
Yeah. So we're not just talking about getting people to the screenings, but opening up about family history is really important as well.
Yep. Absolutely. It's hard to get people to share that information because people are private. It's not necessarily something that's fun to talk about. And I think that's part of this message. Like, I'm out there, I'm telling people about it. I am telling every person I know. I don't end a text or a message without reminding people and they're probably like, okay, Bridget, cool it. Like, get your mammogram done. Get your PSA. What's a PSA? That's your prostate. You got to check that lab level. Colonoscopies are not easy to have done and they're not fun to have done, but they are so important when you can prevent colon cancer. Pap smears. Remind me, doctor, we got the PAP. We have cervical, breast, lung, colon, and prostate. Yeah, so those are the ones that we can actually screen for. So if you looked at my phone or my emails, it's getting a little, a little bit, maybe too much.
Well,
that's
being a nurse,
a woman,
as well.
A nurse, a mother, and a politician. Probably not a great combination, but that's me.
Stay tuned for more of our conversation about breast cancer and the power of early detection. Welcome back to Representative Kosierowski's story, The Power of Early Detection, an important conversation about breast cancer. You did mention that colonoscopies are not easy, and that we know, but I just had my first mammogram, part and thanks to you, because I had the order in my wallet for probably 3 or 4 months and kept kicking it down the road, and then I finally got it done. I was amazed by how easy it was. I think I was there for 15 minutes?
Exactly.
Yeah. Do you think people are unaware of how quickly they can get it done?
I do. I think that a lot of people don't know what it entails, and not knowing how important it is and not knowing the procedure itself can make people fearful of it and not want to spend time on it and not, make the importance of going to do it.
Mm-hmm. Mammograms, of course, are very important in detecting cancer in an early stage. How does that change outcomes for patients?
So if breast cancer, for example, is found early on, it is very curable and very treatable. And if you wait to a point where it's already spread to other parts of your body, if you didn't go for your screening, then it makes it a situation where it's not curable. It can be treatable, but it cannot be curable at that stage.
What are some things, I know, Bridget, you did not have any indication of any cancer before you went for the mammogram. But what are maybe some red flags that people might see that might,
So a red flag would be any change in how your breast feels, your breast shape. If you had a lump, nipple discharge could be a sign. Sometimes just redness or changes in the skin. Those can all be red flags. Mm-hmm. But oftentimes you don't have to feel anything or have a different symptom to have a very early stage breast cancer. And that's who we're really trying to target.
And say you get that scary phone call that something is abnormal with a mammo. What are the next steps?
So you can have an abnormal mammogram and not necessarily have breast cancer. Mm-hmm. So a mammogram is designed to detect changes from a previous mammogram. But anytime a mammogram is abnormal, it may lead to additional testing. So there's different types of mammograms. Somebody might go back for a more precise or a more targeted mammogram. We do ultrasounds and we do breast MRIs sometimes too. And that may look for different changes, more suspicious lesions, which may lead to a biopsy.
And the self-exam, I forgot the actual diagnostic technology we have, but actually just paying attention to your body, doing those self-exams once a month. A lot of times those are just as important too.
Absolutely. I don't know that we've established this, but the representative, you were a registered nurse before you went to the State House, and that has seemingly always kind of informed your legislative process. Is what you're going through now going to affect the way you govern?
I believe so. Yeah, I mean, certainly my 6 years in the House, my lane is healthcare. So that's kind of what I focused on, whether it be insurance or access, which is incredibly important. But yeah, of course, now I'm actually a patient. You know, I talked about them and I talked about the access that they need and the screenings and insurance, but now I am the patient. I became Exhibit A, right? So yeah, of course. I think you become more of an advocate. You have more empathy and compassion to those that are going through it and the barriers that we talked about, for people to just encourage each other to do it. Whether you're encouraging your friends, your neighbor, your family, offering babysitting, offering a transportation. These are things that aren't so easy for some people to tangle. And that's kind of what sometimes causes the delay in that care. Like just like I said, putting it off and just not getting it done because of those kind of things. We don't talk enough about transportation. We don't talk enough about support systems. We don't talk enough about the education. There's a lot of people that just don't know what a mammogram is. How do you get it? What does it look like? What does it mean? And what does it show in the future? So that kind of just information is incredibly valuable, that information. And that's what I'm hoping my platform, my voice, and people partnering up with people like Dr. Liptock can help.
One of the pieces of misinformation I had heard almost my entire life is that mammograms hurt, and they don't.
No, they're just they're uncomfortable.
They're uncomfortable.
Yeah, right, yeah.
It may last a couple minutes.
Yeah, right, and it lasts a couple minutes for what could make a huge difference. A huge difference. Yeah. An important conversation for women. The power of early detection continues after this. Representative Kosierowski's story, The Power of Early Detection, continues now with Bridget Kosierowski and Dr. Kristin Liptock. We talked about affordability before. You and I have had previous conversations for other stories on Newswatch 16 about the costs of cancer treatment. You just brought up not necessarily material costs, but the other costs to women fighting breast cancer, often primary childcare, could be the breadwinner or providing essential, services in the home. Do all of those things contribute? You think to barriers to not only screening but treatment as well?
I believe so. Yes, I think that we don't do a great job at the support system, diagnostics, and getting it. That's we can get down. But then, okay, this is a long road. This is no matter what kind of cancer you have or what kind of outcome, you need treatment. And you need to give yourself the grace and the time to get that. And a lot of times that's really hard when you are when you have the cancer diagnosis, but being a woman and a working parent and a mother, I think it's just a snowball effect, because you're gonna need a huge support system. And yes, it can. You can't cancel your chemotherapy appointment. You have to go get it done. It is incredibly important, but sometimes just getting there to get it done, because it's several hours, right?
It can be.
You can be sitting there getting your infusion, and yeah, it's hard. I know that places like we have here in Dunmore at the oncology, hematology oncology, I am sure they're very accommodating to women that have a child. Nurses are caretakers, so if you have to bring your kid, they're going to make that work. We do make that work, but we need a better system to help, especially with leave of absence, family leave, paid leave. The outcome is so much better for everybody, for that employer, for the employee, for the family, if we can be more supportive in that space. And I work with great colleagues in Harrisburg that are fiercely working on making that better.
Mm-hmm. Yeah, because you know that how much women in society affect our policy decisions. And
a lot of times, and you know this best, a lot of times when everything from where you go to get your hair cut to where you go to the grocery store to where you go to get your medical care, usually the woman in the family, that parent sometimes is the decision maker. But when she becomes the patient, you're turning the tables on the dynamics of the family, and it becomes very challenging. And I think just hopefully we can do a better job at being supportive in that space, because that's part of the treatment, that's part of the outcome.
Dr. Liptock, I'm hoping maybe you can shed some light on this, but I have always, in covering Northeastern Pennsylvania, felt that cancer rates seem higher in this region of Pennsylvania, in this part of the country. Is that something that is actually true?
So I've heard that from a lot of patients before, but cancer rates are really high across the board, and breast cancer in particularly, 1 in 8 women develop breast cancer. And so I look at, some of my friends and some of my friends' parents, and I know 8 of their parents who have had breast cancer, and that's a high number. Colon cancer is very high in Northeastern Pennsylvania. Why? We're not always sure, maybe diet related, but there is a high incidence of cancer all over, not just here. And there's things we can do. Exactly what Bridget has been saying is getting access to screening, but also taking care of yourself, right? Watching your diet. Exercise has been shown to really help prevent certain types of cancers. Maintaining a healthy body weight, avoiding alcohol, not smoking. These are things we can do to help prevent cancer in any area.
Yeah. And something that is important for folks to do, even family history or not, right? Well, I want to thank you for your time here and for adding us to your platform and spreading this message, and wish you the best of luck. And Dr. Liptock, thanks so much for shedding your light as well. And I think this has been a great conversation. Is there anything else that you wanted to say?
I just want to make sure people understand how important it is, and that we have a very great team of people here in Northeastern Pennsylvania that can care for you, and the access to care is what's most important. I think just making sure that we kind of continue to be supportive of our hospital systems, outpatient therapies, those are things that go hand in hand with the whole multidisciplinary approach to cancer treatment. And we are really lucky here in Lackawanna County and Northeastern Pennsylvania to have people that come back home to go off to school and come back home and treat us here. So I hope my message is out there that people that early detection, that screening, and that support system is essential.
Mm-hmm. Dr. Liptock, if there's one thing that you could share to your patients or anyone who might become a patient of yours, what would you like to say?
I would say to do everything you can to take care of your health. Make sure you see your family doctor, discuss your concerns, and go for your screening tests when you're supposed to go for them. Know your family history, know your body, know if something isn't feeling right, and do everything you can to take care of yourself.
Call Kristin and I if you have any questions. Yeah, we'll take
We'll take over.
Yeah.
Thank you, ladies.
Thank
I
you.
really appreciate it. That was State Representative Bridget Malloy Kosierowski and Lackawanna County oncologist Dr. Kristin Liptock joining Newswatch 16 in an important conversation about breast cancer and the power of early detection. Thank you for joining in with us here on the WNEP app.